Hello and welcome to our presentation on our Seed Grant 2020 Seed Grant findings. So I am Jamie Bauer-Malandraki and I'm joined here on this talk by my colleague Dr. Chanel Loudermill. And our project was assessing the impact of targeted cultural competence training in a cohort of MSSLP students, so Masters in Speech Language Pathology students. This is a 2-year project, so we are presenting some preliminary results from this project.
There were two aims addressed in this project. The primary aim was to address and improve the cultural competence of graduate students in the speech-language pathology clinical training program by strategically targeting knowledge, skills, and attitudes related to intercultural issues. The secondary aim was to measure the effectiveness of the program in order to establish a pedagogical model for other programs to follow. Currently, best practices suggest that cultural competence should be infused throughout the curriculum. Some programs tack on a section of cultural competence in their course if time permits. Some programs have a dedicated class at one point in time, or some programs address cultural competence indirectly or minimally. The objectives for this project were based on the Intercultural Knowledge and Competence Value Rubric developed by the Association of American Colleges and University, which uses a 4-point scale to assess 5 areas in 3 domains: knowledge, skills, and attitudes. These objectives were linked to program standards for speech-language pathology developed by the Council on Academic Accreditation in Audiology and Speech-Language Pathology.
So for our project outcome measures, we use 2 assessment tools. So the BEVI, the Beliefs, Attitudes, Values Inventory, which has very strong psychometric validity and does a lot of, gives a lot of insight into group data on sort of individuals' core values and what are the things that shape their identity and work-life relationships. So really interesting tool for our purposes. But then also the ASKS 2+, the Intercultural Attitudes, Skills and Knowledge Short Scale. So this is, rather than being a more rigorous validated test like the BEVI, it's a more Likert scale survey style assessment that's sort of easily repeatable at multiple time points, which is what we how we're using that here. So at this point, there's no large scale validation studies, but it does, one of the ways that it's encouraged to be used is to do this retro pre-administrations that sort of help to control bias in terms of the individual's self-reported knowledge and skills in these areas at the beginning of their experience. And I'll show you what I mean in a second. So the timeline for our outcome measurements is as follows. So we did fall of 2020 baseline measurements with the BEVI and the ASKS 2+. Our midpoint data set, we just used the ASKS 2+, and that was August 2021, in which we did retro pre and what we're calling mid-post assessments. And then in the end of the spring semester of this coming year, 2022, we will repeat again the BEVI and the ASKS 2+.
There were various activities situated throughout this module to facilitate active learning and engagement. These activities were embedded within the clinical practicum course, which students are enrolled in for 5 semesters over their graduate training program. Many activities were experiential in nature and included reflections, seminars, assigned readings, and debriefings designed to address issues related to cultural and linguistic diversity in healthcare and in service delivery. Active learning and engagement activities were linked to the course objectives and learner outcomes. This table shows the first semester of activities. So prior to beginning the program, each student was asked to complete a pretest, and that was the BEVI and the ASK 2 before the experience assessment. Once the program started, during their orientation, they had an introduction to diversity, equity, and inclusion, where they completed an icebreaker activity. As the semester progressed, there was a seminar where there was information provided based on an overview of cultural competence, where the roles and responsibilities, ethical considerations, and diversity and treatment those things were discussed. And this was linked to the learner outcome number 1 and the course objective of knowledge, cultural self-awareness. They also participated in a seminar on implicit bias in healthcare and education. Microaggressions were discussed. They completed an activity which was the implicit bias test. There were selected articles and papers that were assigned, and they wrote a reflection discussing the results of their implicit bias test and the readings and the articles that were assigned. During the spring semester, students were provided a list of diverse films. That list contained fiction and nonfiction movies that targeted diverse groups. Students were divided into groups and they were asked to select a film to review as a group, and they also wrote a reflection based on that film and engaged in the class discussion. A little later in the semester, students engaged in a seminar where cultural responsiveness and service provision was discussed. We discussed assessment and treatment. We looked at assessment and treatment materials for bias, and then we engaged in a discussion about how to adapt those materials to meet the needs of our clients. By the end of the second semester, they participated in the mid-assessment, which included the retrospective assessment for the ASCE 2, and they also completed the post test for the post survey for the ASCE 2 based on their experience. As they entered the summer semester, they participated in a workshop on ostracism, identity-based rejection, and sensitivity, and they also completed a book reading where they were given a list of books to choose. Again, they separated into groups. Each group read the book, engaged in small group discussion, and then we later had a larger group discussion based on the book that was chosen. During the first spring, students completed an activity in which they viewed a fiction or nonfiction film of their choosing and provided a critical review. The films represented various cultural groups, and students were given specific question prompts to answer after viewing the film. Students submitted their written reflections and engaged in a group discussion about the film. Students also participated in a seminar addressing cultural responsiveness and service provision as it relates to assessment and treatment of individuals with communication disorders. They completed an activity where they reviewed assessment and treatment materials for bias and discussed how those materials could be adapted to meet the needs of their clients or patients. During the summer, students participated in a workshop where research data on ostracism and identity-based rejection and sensitivity was presented. Students also participated in a book reading that was similar to the format of the film review. Students were given about 8 books focused on various cultural groups and experiences. They were then grouped based on their book selection and engaged in small group discussion and later large group discussion, sharing highlights of each book. Again, in this table, you can see the course objectives and learner outcomes that were related to each of these activities. During the second fall, students completed an immersion experience. During this experience, students were asked to intimately explore a culture that was different from their own by participating in events or rituals or exploring cultural centers on campus to learn more about a specific culture. One main point of this activity was for students to experience what it is like to be a part of an underrepresented group in a given space. Students also wrote a reflection and engaged in a discussion about the immersion experience. Reoccurring themes and questions from the reflections were among the topics of discussion. During the final semester, students will be off campus and they will be expected to apply the knowledge and skills related to DEI in their off-campus clinical externships. Students will complete a video journal regarding their interactions with a cultural or linguistically diverse client or patient. At the end of the spring semester, students will complete the post-assessment, which includes the Bevy post-test and the ASKS 2 plus retro and post surveys.
So preliminary results from the Bevy, again, this is just from that initial pre-data set point. We don't yet have anything to compare this to, so I just have some interesting group pretest results in these different areas that the Bevy examined. So generally our students, I believe, scored very well in these areas: the resilience, well-being, the way that they tolerate, the tolerance of disequilibrium, comfort with difference is perhaps an area where there could be some additional growth. But when our colleagues at Silmar ran the data for us and sort of looked at different demographic impact on any of these results, the only significant difference that they found were with our lower income students, of which we don't have that many. But interestingly, what I found fascinating was that this group of lower income students had higher emotional intelligence, better critical thinking skills, what's referred to as lower gender and religious traditionalism, higher social cultural openness, and then higher global competence. So I'm really excited to see when we do the post test what differences we might see with this group by in isolation, and certainly as compared to the remainder of the group. But I just found that to be pretty fascinating, and I don't know, it's sort of like rooting for the underdog. I feel like it was really great to see that that finding in our data set to begin with. But going forward to the ask, so this is where we at least have some initial analysis that we had done. So this is a picture of the ask. It's a 14 item scale, so pretty quick, repeatable. It's aligned with the AACU domains. So there's 2 questions for attitude and openness, 2 questions for curiosity, 2 questions for the skill of communication, 2 for the skill of empathy, 2 for knowledge worldview, and then 4 questions for knowledge self-awareness. So given the non-parametric nature of these data, they're ordinal data, we approached it with a Wilcoxon signed rank test for statistical analysis at this point. But before we did that by domain area, we just kind of wanted to group and look at the means. And so combining these areas, again, these are the different AAC domains. So attitudes, openness in the bottom, attitudes, curiosity, and so forth. That brown line on the bottom is the pretest, so their pretest scores. And then the light brown on the top is the post, that what we're calling the mid-post, so that mid-post data point from last August. And then that middle bar is that retro pre. So you can see, again, just by looking at the numbers, the mean set of our students, that the retro pre score is lower, which suggests that there's more room for growth at that midpoint data set than the pretest, right? So this follows the logic of giving that retro pre-assessment for which the ask is designed, which is that it can control for some of that bias that students can self-inflate their own responses based on what they want you to hear. And then certainly showing some change at the post-analysis as well. But so again, this is preliminary findings just from pre to mid for attitudes and openness. For both of these, the 2 questions, we found significantly increased scores from at mid-post as compared to the retro pre-assessment. For attitude curiosity for these 2 questions. For question 3, we didn't find any statistically significant difference in any of the administrations. But for question 4, we did. Again, here the mid-post had increased significantly over the retro pre scores. Similar findings in the skill of communication, in that for both of these questions, the mid-post score had increased significantly over the retro pre-scores. Again, same sort of trend with that mid-post being significantly increased over the retro pre-scores for both of the empathy questions. But also for question 7, we see mid-post significantly increased over the pre-scores as well. Knowledge worldview, again, just one of those 2 questions. The first question, question 9, showing the mid-post score being significantly increased over the retro pre-scores, but no significant differences for question 10. And then these 4 questions in the knowledge self-awareness all showing significant change from pre to retro post, but questions 11 and 12 also show a significant increase mid-post to pre. Now, interestingly, for none of the data sets was there a statistically significant increase between pre and retro pre scores, right? So that reported values for their starting point data. But again, we see there's a couple areas where, at least between pre and post, we're seeing some significant findings. Although, again, for most of these questions, it's the mid, post, and retro pre that seems to be hold the most value. So it'll be interesting to see what comes of that in the next iteration of our data collection. So certainly, significant improvements in all domains. And then again, two of those questions, one question on curiosity and one question on worldview, where we didn't see any of that statistical significance at this point. So it's some early positive evidence for the effectiveness of this educational module. Again, it's looking at targeting increased cultural competence within our clinical training program.
As mentioned earlier, this is a 2-year project, so we will be collecting the final bit of data at the end of the spring 2022 semester, and we will analyze the rest of the data comparing our pre and post BEVI assessment for group changes in beliefs and values, and we will compare our mid-assessment ASCE2 plus, the retro pre, and our post-assessment, the retro pre data, to the final post-assessment. Upon analysis, we hope to determine if this model was effective in addressing cultural competence in our clinical training program. We will also examine student feedback and determine if any of these activities should be modified in any way.
So just thank you to Silmar for your support of this project. It's an ongoing effort here. We have another few months of work and data collection, but we're excited to see what this yields. So thank you so much to Silmar for your support of this seed grant project.